President.
Senator from Alaska.
The very eloquent and articulate comments from my friend from Florida. We recognize that his time here in the Senate has been relatively short, but in terms of an individual jumping in with both feet, embracing the challenge that we clearly have in front of us, and representing the constituents of the state of Florida in the manner that he has, I think, deserves public recognition, and I thank you for your leadership. We've had occasion to talk about the similarities between Alaska and Florida, and you might not think of there being much in relationship there, me being in the north in the cold versus the sunny south in Florida, but when it comes to our senior populations, this is where we have truly a shared interest. Florida is probably the largest number of seniors per capita, and in my state of Alaska, we are the state that has the fastest growing population of seniors per capita. One might not think of Alaska as being a retirement haven, but more and more we are becoming so. And we share the same problems when it comes to access. When you can't get in to see a provider, when that insurance card is really all we have given you, then we haven't done anything, Mr. President, to really provide for a level of care to improve the situation for the residents of Florida or the residents of Alaska. So what we're doing today as we move towards final passage on legislation that I would concur with the senator from Florida, we are not fixing the problem. We are not dealing with how we appropriately and adequately provide for access to quality health care. We have much work remaining before us. And Mr. President, we've had some time these past couple days, actually these past couple weeks, as we have spent considerable amount of time in our office waiting for votes at 1 a.m. in the morning or early morning votes at 7 o'clock in the morning. I've had a chance to go through some things on my desk, but I've also had an opportunity to spend a lot of time checking to see what people are saying when they are contacting our office. And the volume of correspondence, whether in emails or faxes or phone calls, coming in from Alaskans at this time has been absolutely unprecedented. I think typically in the legislative calendar about this time, several days before Christmas, you don't see constituents contacting their senators and pounding the drum. Well, let me tell you, the people in Alaska are pounding the drum. In just the past 24 hours, we've got probably close to about 500 healthcare emails that have come in. Overwhelmingly, these are emails from constituents saying, no, this is not good. You must do what you can to prevent this reform package, as you call it, from moving forward. And it seems that the longer the people from Alaska, the longer the people from around this country have to look at what is contained in this 2,000+ page bill, the more they realize the negative impacts, the consequences to them and their family and their businesses. And they are no longer silent. I've had so many calls and letters coming from people saying, I've never weighed in with you before, never weighed in with my delegation, but this is something that I can't keep silent on. And when you look at just some of the ones that have come in, these are just today's that I'm looking at. There's one from a woman in Anchorage who says, yesterday on the TV news, I heard about the sweetheart deal Senator Nelson made regarding the rest of us paying Nebraska's Medicaid bill forever. To say that I'm angry is putting it mildly. There's a gentleman in Fairbanks who writes in, I'm very skeptical about this mandatory health insurance that apparently everyone will have to buy in. This is from a fellow in Anchorage also. He says, you're moving a health care bill that can't be understood unless a person has a law degree. Another individual, this is an interesting one, he and his family apparently own 4 indoor tanning businesses. In Alaska, we need to get a little sunshine, even if it's not what God has provided us, but these are good businesses. And he says, when did this go from a 5% tax increase for cosmetic surgery to 10% for indoor tanning anyway? And he adds that adding another 10% tax hike on small businesses like indoor tanning will likely drive many families just like mine into bankruptcy. Mr. President, I could go on and on in terms of the stacks of correspondence and phone calls that we've gotten in, but suffice to say, the more people understand what is in this legislation, the greater their concerns are. And really, the greater their outrage as they learn what is contained in it. One of the things that I learned just yesterday, which I don't think we've gotten the focus or the attention on this. This is a concern that was raised by the Anchorage home builders and the Alaska State Home Building Society. They have pointed out that as an industry, the home builders industry, they're being unfairly singled out in this bill. Now, we've talked about the employer mandate that is contained in this legislation, and that mandate applies to those businesses with 50 or more employees. But there's a zing here in this legislation to home builders who are now responsible for providing federally approved health benefits if they have 5 or more employees. Well, look at what's going on throughout this country, Madam President, in terms of industries that have taken a real hit with this economic downturn and this recession. The home building industry has just suffered incredibly during this downturn, and now we are going to, on top of depressed house prices and increases in home foreclosures, we're now going to punish them with an employer mandate that treats them worse than any other employer. So, in other words, if you've got 5 or more employees as a home builder, you need to know that your industry is the only one will be subject to the employer mandate of $750 per employee. Now, in Alaska, we checked to see how many individuals are home builders within the state. We've got about 250 home builders in Alaska, but when you look to see how many individuals they employ, that's about 3,078 employees. It's about 12 employees to every builder. So the total home building industry that would be impacted is about 800 employers in my state. Yesterday, there was a letter that was sent to members of the Senate here, and this is from the home building industry as well as many other associated industries, the air conditioning contractors, the builders and contractors, the electrical contractors. But I want to just mention some of the statements that are contained in this letter. Again, it's written yesterday, and they say, we're writing to express our strong opposition to language contained in the manager's amendment, which excludes the construction industry from the small business exemption contained in the bill. The fact that the manager's amendment was made public less than 2 days before the first vote on the matter has increased the difficulty of playing a constructive role in the legislative process. And I'll just take a little detour here from the letter. This is part of the problem. You've got these organizations and these groups, and there's a list of about a dozen of them here that have signed on to this letter. They had literally hours before we were forced to vote on the manager's amendment. They didn't know what was in the bill and how it impacted them. They go on to say, the manager's amendment singles out the construction industry by altering the exemption so that it applies only to those firms with fewer than 5 employees. This is an unprecedented assault on our industry. It is unreasonable to presume that small business owners can bear the increased costs of these new benefits simply because Congress mandates that they do so. And they go on to conclude in the letter, we are unaware of any data or evidence that suggests that the needs and struggles of a construction contractor with fewer than 50 employees are so different from those of small business owners in other industries. And absent such convincing evidence, we are left to assume that this specific provision is merely a political payoff to satisfy the desires of a small constituency. Well, Madam President, those are some pretty strong words there towards the end. But it does cause you to wonder why, in this legislation, if we're going to require that only businesses in excess of 50 employees are going to be subject to this mandate, why this unprecedented assault on the home builders? I don't get it. But what it does cause me to get is that there is a heck of a lot more out there, that the more we read it, the more we sit down and we connect the dots, the more we realize that this fish that we've set out on the front porch is just going to continue to stink. It stuns me. We've got the home builders up in Alaska that are just beside themselves, saying, can you take a look at this and let me know how the senators feel? What are you going to do about this, Lisa, is the question that that I have received. Well, this is something that we all have to reckon with. And Madam President, at the conclusion of my remarks, I'd like to make sure that the copy of the letter is included as part of the record.
Without objection.
Madam President, I want to speak a little bit about how aspects of this legislation have impact specifically on my state. As a rural state, sometimes the impacts that we see are different than you have in more urban states. Our geography is different, our lack of providers, our high senior population, our extremely expensive costs. There's a lot of dynamics at play that cause real issues and real concerns. And there have been many words that have been exchanged on this floor about what this bill doesn't do or what it does do. I find it helpful to go to the experts, the think tank in my state, and ask them flat out. We've got a institution at the University of Alaska called the Institute of Social and Economic Research, and I take what they have to say very seriously. I also take very seriously what our Congressional Budget Office has to say, what the CMS actuary has to say, because I think, as my colleague from Florida pointed out, these are the independent arbiters. These are the guys whose job it is to really work the numbers. So I'd like to discuss some of the findings from the University of Alaska, also try to inject a little bit of common sense into the debate as to what it means for Alaska, how it increases their premiums, how it raises that cost curve on the federal health care expenses, the taxes on the small businesses, for the individuals, the families, the health benefits of the police, the firefighters, other public protective services who put their lives on the line for so many. These are the things that, unfortunately, we might not be getting the full picture. Now, our colleagues on the other side have claimed that health care coverage will be expanded. And again, let's go to our nonpartisan entities, the CBO and the Joint Committee on Taxation. The average premium per person, if you purchase in the individual market, is going to be 10 to 13% higher in 2016 than the average premium under current law. So that tells you that if these federal scorekeepers are correct, your premiums are going to go up under this health bill if you buy insurance yourself. Now, in Alaska, according to ICER, the Institute of Social and Economic Research, you've got about 28,000 Alaskans who would pay 12% more for their premiums. It's going to cost an individual in my state an extra $1,100 per year, and a family in my state nearly $3,000 more for the coverage by the year 2016. So again, you've got to ask the question, is health care really expanding? This bill forces you to purchase federally approved health care. Otherwise, you have to pay the penalty of $750 or 2% of your income if you earn more than $37,500. Now, as you look at Alaska's population, this is going to bring in more than 50% of Alaska's population who are going to be penalized if they fail to have health insurance. So again, you ask the question, is health care coverage going to be expanded? Well, since the law that we are advancing is going to require that you buy federally approved health insurance, and then we're going to penalize you if you don't buy it, then what you have is the heavy hand of the federal government who forces you to buy health insurance, which is going to cost about 12% more once this bill is enacted, 12% more than it would today. Now, the Democrats will also talk about the hidden tax on families and how that will go away, because once this bill passes, under this bill, everyone's going to have coverage. Well, Alaskans and all Americans who do not get federally approved health insurance that the federal government is going to require that you have, they're going to be fined $750 or 2% of your taxable income. And what the Democrats won't tell you when they say that health care coverage is going to be expanded or the hidden tax goes away is that those with income greater than $37,500, again, affecting over 50% of the people in my state, are going to be taxed at a full 2% of their household income once the bill's fully phased in if they don't get health insurance. And it's this penalty that's going to raise $15 billion to help pay for this bill. So this is how we're paying for the bill. CBO and CMS, they've told us that the taxes on medical devices, whether they're tongue depressors or x-rays or blood sugar meters, these are going to be passed on to the individuals. So you're going to be taxed for vital medications and other health products. And the question that you then have to ask yourself, okay, so do these hidden costs actually go away? And I suppose they do, because they're no longer really hidden. What we will have done is we will have raised your premiums, we will have increased the penalties on those earning more than $37,500 who didn't buy into health insurance, and we will have taxed you on tongue depressors and your x-rays to pay for the bill. And in addition, the smallest of the small businesses are going to be taxed if they don't provide insurance for their employees, and individuals and couples earning over $200,000 are going to be penalized because they're the higher income earners. Now, the Democrats are also telling you that as the Medicare patients, they're going to get some good, positive things. They will get free preventive services. And this is good. This is absolutely great. We should be encouraging preventive services. But as my colleague from Florida was explaining, as I have mentioned, after this bill passes, are any of the 13, or I think we're down to only 12 now, primary care doctors in Alaska, or in the Anchorage area anyway, accepting new Medicare patients? So we're saying, well, we're going to provide this service to you. We're going to, no cost. But again, if you can't get anybody who will take you as a patient, how are we really helping you? We've heard, again, we've heard from a doctor in Anchorage. In fact, I've got an opinion piece that was published just this week in the Anchorage Daily News that I'd like to submit to the record. But she's indicated that she's dropping out of Medicare, and she's doing it because of this legislation. It is no secret, Madam President, in my state of Alaska and in far too many states around this country, we just don't have enough providers who will take these individuals. ICER has said that seniors in low-payment Medicare states will be forced to wait in line. Well, Alaska is one of two states. We are, I think, the second to the last in terms of Medicare payments and where we stack up in relation to the reimbursement. ICER goes on to state that independent of the doc fix, in Alaska, the remainder of seniors are at risk of long lines to see a primary care doctor and overflowing to community health centers and hospital emergency rooms where existing capacity is highly likely to be quickly overwhelmed and long wait times become increasingly common. They've also said that additional new insured patients are going to hurt Medicare beneficiaries, and they state federal health care reform applied to Alaska likely will exacerbate an already very challenging access situation for Alaska's seniors as baby boomers age into Medicare and finding themselves waiting in line behind a rapidly expanding line of better-paying private plans. We're told that 5 years from now, our Medicare population is going to increase by 50%. We can't accommodate those who are Medicare eligible now. Our boom is not sustainable. The CMS actuary has said the Reid bill reduces payment updates to healthcare providers which are unlikely to be sustainable on a permanent basis. As a result, providers could find it difficult to remain profitable and absent legislative intervention might end their participation in the Medicare program. Well, it is happening. Doctors, providers, physicians are making those decisions as we speak. They are opting out. So this is not just some theoretical approach to the problem. This is happening, Madam President. Madam President, how much time do we have on our side?
17 minutes.
Okay, thank you. And if I may ask my colleague from Kansas, do I understand that you're seeking about 10 minutes? Is that correct? Okay. Just so that I know what we're doing here in times of time. Thank you. I want to speak just a little bit about small businesses because we've all been talking about the impact to small businesses. Under this bill, as we know, small businesses are going to be penalized $750 per employee if even one of their employees seeks governmental health care, whether it's through Medicaid or through the federal subsidies. So if you've got 50 or more employees, you can be expected to pay fines in an amount of $750 per employee, which amounts to over $37,000 or $3,000 for that individual employee. And Madam President, I think we need to kind of put it into perspective in terms of who these businesses are. These are the solo practitioners, like the one lawyer office or the small doctor's office. If these individuals in Alaska purchase health care in the individual market, they're going to see their premiums go up an extra $1,160 per year for a family, nearly $3,000 more in 2016. One of the things that we face in Alaska is we're defined as a high-cost state, and if you're a small business who can afford to pay good health and dental benefits for your employees, and those benefits amount to $8,500 per individual or $23,000 per family, in a high-cost state like Alaska, you look to be hit with a 40% excise tax because you basically want to provide your employees with good benefits. Again, according to ICER, they say this: Alaska is a high-cost state, and thus roughly 50% of health plans in Alaska will be subject to the tax by 2016. This is compared to only 19% average in the lower 48. Again, by 2016, 50% of the plans in my state will be subject to this 40% excise tax. And I would like to also include in the record a letter that we've received from the municipality of Anchorage. This is from their Police and Fire Retiree Medical Trust. City of Anchorage, largest city in the state. We've received this letter just last week, and in the letter they cite specifically to 3 provisions in the bill that are of particular concern. Number 1, inclusion of health care benefits as taxable income to employees. And it states not only will this increase the employee's taxable income, but the municipality of Anchorage's payroll tax will also increase. Their second point is the taxation of the municipality's health care plans. And they state this tax will be imposed on the employer. The current municipality's health plan design is apt to be considered to have an excess benefit. This would make it subject to a 40% excise tax. They go on to say there is also an aggregation rule for the value of employee coverage with multiple employers or retiree medical. If a retiree would purchase the municipality's health insurance, that's considered excessive. The 40% excise tax would be incurred. One may argue that the tax is a tax to the employer. The argument can also be made that the trust is an integral part of the municipality. Thus, the tax would be payable from the trust general fund assets. And their third point contained in the letter is that current municipal employees are able to be reimbursed tax-free from money that they have placed in their flexible spending account for over-the-counter medicine. Retired police officers and firefighters also currently are allowed this reimbursement as part of their medical benefit. Under the rules of this bill, these reimbursements would no longer be allowed. This is a reduction in employee benefits. It is also likely to encourage an increase in the utilization of more expensive non-over-the-counter prescriptions, as they are a covered expense. Madam President, there's about 400 members that are part of the Police and Fire Retiree Medical Trust. When they find out, as I'm sure they will, the more they learn, when they find out that essentially they are going to be taxed on their plan. I think most of these firefighters and these police officers don't view themselves as having access to a Cadillac plan. They're just firefighters and police officers. But this is coming from their trust fund, expressing great concern over what we have in front of us. And a concern, again, that I want to have included in the record. Madam President, I've mentioned that we have received a copy of an opinion piece from a primary care provider in Anchorage who has outlined why she is opting out of the Medicare system in Alaska. I'd like to include her letter to the editor, and I would also ask, and these will be my final remarks here today, one of the things that we don't have in this legislation is a provision that relates to medical malpractice. It's been stated that, well, in Alaska, you tried medical malpractice reform, and we haven't seen the positive impacts. I'd like to include a statement from the Alaska State Medical Association, along with an article that was published in Alaska Medicine in September of 2009, entitled Malpractice Relief, Lower Premiums, Tort Reform, Add to Alaska's Appeal. And the
Without objection.
Thank you, Madam President. The bottom line that the Alaska State Medical Association provides is that the cumulative result of Alaska physicians' advocacy has been a success for physicians and their patients. And again, we've seen positive impact in Alaska because of the laws that we have passed. I think it's unfortunate that we didn't take that opportunity as we dealt with healthcare reform these past many months. Madam President, at this time, I will yield to my colleague from Kansas and thank the chair for her attention.
Madam President.
Senator from Kansas.
Thank you very much, Madam President. I'm glad to join my colleague from Alaska and Florida and talk